Hi, Lillian.
Good morning, Lillian.
Unmute yourself. Yeah.
Okay, thank you. Good
Yeah.
morning. Good
Good
morning,
morning.
everybody.
I guess we can just start with
With the tragic news that
yeah.
you lost one of your own.
Yes, we did. We lost one of our soldiers, one of our colleagues, one of our comrades. And so it's painful and it's sad. And we're grieving. Staff are grieving, but, we have to heal. Because we have to continue this fight. As Daphne said, we are stronger when we're united and working together. So we just have to continue fighting this epic battle of this virus together, united, and not against each other. And so we're moving on. We continue to receive individuals into the ER who are COVID positive, and so we've had some new admissions into the hospital. We have our FM team and all our staff here have come together to then open up a section, actually put a partition in the second floor ICU to then separate the non-COVID and the COVID ICU patients. So that gives us an additional 7 ICU beds for COVID patients. And so, we're constantly trying to figure out how we're going to accommodate these patients and continue to take care of them and handle them as they come in. And so, with regards to the 2 individuals who passed away, it is sad, it is painful, and our condolences to the family and our prayers. And also at the same time, we're trying to support our nurses, our nursing staff who worked with the nurse because she was here for many years. Five, that's half of the ICU. I thought I mentioned earlier that gives us 7 beds, seven
Okay.
ICU beds
For COVID and for COVID only.
for COVID.
For COVID.
For
Okay.
COVID only, yeah. We separated that whole area. Half of it is for non-COVID. The other half, which is 7, we're using 7 for COVID.
When you say partition, what do you mean? Are you talking about like a curtain or what?
A sheer plastic curtain to again prevent the transmission across, but at the same time for some visibility. So yeah, it's just separating and making sure that those who are not COVID ICU, they're on a separate. There's a separation.
So they're
There's a
not sharing
partition.
the same air.
They're not right.
Right.
Exactly.
And the 4 in the emergency room, are they in
Mhm.
isolation? I thought there were only 2 isolation rooms in the ER.
There are 2 isolation rooms with the capacity for negative air pressure. And so, but there are isolated. The others are protected. So we maintain isolation for those individuals with a COVID positive.
Lillian,
We put in measures.
I just wanted to go back to the tragic loss of one of your own. And what's the mood like when you guys lose a nurse, but in the middle of this war, no matter what, the next day you got to get back up and come into work again. So just in talking with your staff
Yes.
and doing the rounds this morning, what are they saying?
I haven't had a chance to go and do rounds this morning, but right after yesterday's situation, the doctors who were working with the staff and the nurse who passed away, they did a debriefing right then and there, and so allowing the staff, because they were all shaken, and so allowing the staff and recognizing that they're going through some emotions that need to be supported. And so the doctors were very good in doing that for the staff.
I wanted to read this because this is going around. It's a graphic of Marnette Agabao, and there's a little screen cap of a WhatsApp message to my ORPACU family. Thank you so much for the beautiful orchids. You made me cry knowing that with the short time that I worked with you, I felt welcomed and appreciated. Thank you for your prayers. I'm slowly recovering and hope to be on my feet again soon to work. God bless, keep safe, and keep up the good work. So I think it's
Okay.
just even harder to read that and knowing that she was at a point where she thought she was going to recover and go back to work and get right back into this battle.
Mhm. Right. That was, yes. You know, we thought that she was making some progress. She was even looking to retire. So it's sad. It really is.
I would.
And you know, all the more reason that you know we have to fight. We have to continue this fight and prevent others from dying and prevent others from getting really, really sick. And so, as much as the governor and everybody else, the surgeon cell, the physician advisory group, and all of us, professionals and nurses, and you know, we've been telling the community to really heed the warnings to prevent the infection. You know, but unfortunately, you know, people are human beings, and so they want to continue doing what they want to do as far as their activities and what brings them, you know, satisfaction. But at the same time, they really need to take this, and I've been saying it, take this very seriously. It's a concern. Be responsive, be responsible. We don't want to see any more death. And so, you know, help us with that. And if you're starting to feel, and I don't think that we can, I don't think that we can really stop the spread of infection because people are going to get it. But you know, the secondary prevention is, you know, if you start feeling the symptoms, get tested, see your doctor. You know, and don't wait for 7 or 10 days that you've been having the fever, you've been having the abdominal pains, the headaches. You know, go and get attention right away, medical attention, so that you can be treated as early as possible and not get to the point where you're seriously ill. And so, you know, again, please, let's all take heed of this brutal virus. It's a brutal virus. And so, you know, it sneaks up on you. And just when you think that you're not going to get it, you just keep that mask on, keep the distance as much as possible. And so let's try and let's just, as so what Daphne said, we are stronger when we're united and not against each other, not fighting against each other. But we have to come together and fight this battle.
Thank you, Lillian. God bless you, and keep us posted. We'll be praying for you and your staff.
Thank you. Prayers are very powerful and very helpful.
Take care, Lillian.
God bless
You
you.
too.
Wash your hands.
Take care.
Okay, that's that.
Yes.
9:20. We'll take a short break, and it's been a minute since we checked in with the Guam Fire Department. Obviously, they're doing a lot of things with the COVID-19 response, so we'll do that next. 9:20. The link on the brief.